Drake. I'm an occupational therapist. I work at Glenbrook Hospital in Glenview, Illinois, which is about a 200-bed acute care hospital. I cover all major units, and this year I have also been working on our COVID team. But specifically what drew me to OT was I got a chance to really use my creative side in a more medical way, and I really get to connect with different people. So each day I'm meeting 10 new strangers, and it's kind of fun to try and figure them out and put the pieces of the puzzle together to help them medically. So especially in a hospital, I'm looking at how are we able to access the bathroom? How are we going to be able to get dressed if your hip is broken? So in terms of the creativity OT has, we kind of have to think on our feet, know different equipment that people can use, and come up with kind of unique solutions to do everyday tasks. I work on a team with a ton of PTs, a ton of OTs, a ton of speech paths, and the communication between all of us every day. I'm working with my coworkers on various tasks, trying to figure stuff out. So that's definitely a perk of where I am. Day in and day out, especially in the therapy team, we're working together to kind of get our patients to the same goal. So if the goal is to go home, what exactly do we need to lay down in 2-3 days for them to get home? But then also a ton of collaboration with nursing, when are patients appropriate to be seen, different medical vital signs, whether they're appropriate for therapy, I should say. And then also talking with doctors. So at the end of the day, they are our medical specialists, but they also heavily rely on and value our opinion on what patients need before going home and what that looks like. So keeping communication lines open day in and day out, talking with doctors firsthand in person or chatting them on our computer software is super important. So I live up in a suburb of Chicago. So we surged pretty early in comparison to kind of what's going on in Missouri. And my entire hospital flipped to a COVID hospital. So we had over 200 COVID patients for a couple of months. It's finally slowing down, but it was intense. Everything you've heard about PPE was my life, getting dressed up every day to go see my patients. But that also kind of changes how we treat them. So we're looking at different things from an OT's perspective. So we're looking at energy conservation and educating them on that. We're looking, and along with that, kind of the equipment that they need to go home, being able to take rest breaks. Healthcare workers as a whole, we weren't going in the rooms as much as we normally would be, just to reduce the chance of us being vectors. So as a healthcare team, we were so much more reliant on each other, even like doing basic vitals. The therapy team would be doing it for nursing because that's one less chance of someone having to go in the room. Same thing, having to really be able to relay what we saw with patients to the doctors, because they weren't going in and sitting in on sessions. They're kind of observing what was going on. So I have never felt like I have been on a bigger team than with COVID. I think being in the hospital, sometimes we kind of get into our own little ruts and I do this job and they do that job. And I think with COVID, we've all had to kind of take a step back and realize that as healthcare workers, we're working together. We all have the same goal. We want the best quality of care for our patients and we want to see them go home successfully. In order to do that, we need to really work together, talk, collaborate more than we were before to reach that goal. It's okay if you don't fully understand what someone does or what their role is or what they have to offer. One of my biggest pieces of advice is just ask. I work with PT a lot, and a lot of physical therapists don't realize that OT covers a huge chunk of cognition. And I think it's okay for my coworkers to be like, hey, explain to me what you're doing, explain to me why you're doing this, what you're looking at. I encourage people to kind of ask because I think it's beneficial to that whole team role. And you get to realize the strengths of a lot of your coworkers and the strengths that other people bring to work and what they can help you with.